Hello, everyone. Thank you so much for having on. My name is Ransom Yima. I'm a fourth year radiography student studying at Federal University of Technology, Owerri, Nigeria. And apart from my medical radiography studies, I'm also a medical content writer, a proficient medical content writer, and also a YouTuber. So today I have an amazing personality as our guest speaker. Hey, Dr. Mars, could you please introduce yourself to the audience? Thank you.
Thank you so much, Ransom, and thank you for having me. My name is Mories Atoki. I'm the Chief Executive Officer of the African Business Coalition for Health, also known as ABCHealth. And we're a not-for-profit social impact of the private sector community to sensitize them in order to mobilize resources to improve health and healthcare on the African continent. Um, yeah, basically that's what.
Amazing, man. Amazing. So, man, we have a couple of questions for you to answer. You ready? Now,
Yes, we do.
all right. So, I'm reading the questions to Dr. Mars because I've written down the questions on a piece of paper. So, you guys will be wondering why I'm looking down was for. So, the first question for you, ma'am, is as CEO of ABC Health, can you share some of the key strategies you use to drive growth and innovation in your organization? Talk us through, Dr. Maris.
Right. I think first and foremost is a lot of work in understanding um, the industry insight and so when I say the industry insight, you must understand the health itself as a sector, as um, as a system, and it's an alignment. It's alignment with government and how it works. So for me, knowledge is really critical, and me applying myself and just really positioning myself to learn a lot about that is one of my key uh, strategies. Another one is by itself. So again, there's a board over me that I need to report to. Part of the report to the board is at the very start prepare a 5-year strategy for also what you're asking for the growth and the direction of the organization. And so, in putting that 5-year strategy is to identify experts and technical partners that know more than you do to be able to infuse that knowledge in planning oneself for the growth and innovation of the organization. And then plugging both together just really combines um, a lot of traction and synergy and opportunity that can enable the organization uh, be a bit more creative locally. One that is important is the partnership with the UNECA, the United Nations Economic Commission for Africa. And the idea really is to have that, is to be, is to deliberately have that regional alliance so that we're not mistaken, we're impacting on the continent and not, at national level alone, since we already have organizations within the same ecosystem that impact on organizations. So with the UNECA, there are two initiatives in purview. Uh, one is sequential to an initial one we had when ABC Health was established in 2019. It's a report called Health and Economic Growth Report in Africa, and just really pay attention to those choice of words, health and the growth of the economy. So as private sector spearheaders and champions, our mission really is to bear the whole region to the attention of reconsidering and reimagining health as really pivotal and that's really um, instrumental to advancing economic growth um, on the continent. And so that's what that report is. There's a lot of mix around direct non-health and non-health and health actors who have contributed. So we're very also passionate to bring the economy ratio into the conversations, to bring the business um, direction and the business understanding into the conversation, and ultimately to send the message and sensitize every African citizen that a thriving economy is indeed a healthy one. And so that's what that report is about. And the second one is also health and economic growth report in Africa, but now called Doing Health Differently Beyond COVID-19. And that came about at the time when COVID happened. Um, and yeah. Another initiative is the West Africa AFCFTA pharmaceutical um, initiative. The idea is to remind Africa and African leaders that there are opportunities in the pharmaceutical sector. Because again, I don't know if you know, but we import over 95% of the pharmaceutical supplies, so medical supplies, medicines that we take in on the continent, and we're talking in excess of 6.3 billion dollars going out of the economy of the continent on an annual basis. And so the idea is to put that initiative together to give opportunities to local manufacturers of medicines and medical supplies to look inwardly and see how we can even begin to leverage or utilize some of those uh, monies that are already going outside of the continent. Um, and so, yeah, those are the fundamentals that actually is our um, key strategies to help us to drive growth and innovation. Oh,
Amen. Thank you so much, Dr. Mercer, for this strategy and how you have an organization. Yeah, so much talk spirit. So, the next question for you, ma'am, what are some of the most important issues faced both direct and teas? You know, challenges to talk us.
no, I didn't hear that question. You need to repeat
Okay,
it.
so what are the most important issues faced both direct and teas?
I hardly hear you. I didn't hear the question. I know you're speaking, but I can't hear your question.
You
You
have
need
an
to.
issue. Okay, I'll repeat again.
You
What are
can't
some
repeat
of
it. I can't hear you. So you might want to put it on chat so that I can respond to
okay.
Okay, I caught the
Okay,
question.
ma,
So the
I think I
question is,
sent you.
what are some important, most important issues? I face as a board of director, a member of the board, and as a
Absolutely.
trustee. So those are joint questions. Generally, uh, the board has three major functions: to guide and to direct, to guide on policies, and to make significant and strategic decisions, and of course to oversee a company's activity. Therefore, it's just really not an issue, but an important element of participating at board level and as a trustee level is ensuring that you're making informed decisions and you're not just making emotional decisions. It's important that um, you're making decisions and you're guiding the organization um, based on wealth of experience and knowledge that are applicable to the times we're in and to the growth of that organization. So for me, it's just really ensuring that whatever contributions in terms of the strategic direction and decision that you are empowering an organization to make is being led from a robust point of view, and you're not limited, because if you're limited and you're not doing your work in building yourself and allowing and shortchange the organization. So again, it's the most important issue really for me will be ensuring that my perspective, my point of view has relevance to the times, has market centric, as industry um, specific, and the organization is able to use it effectively.
Absolutely. Um, Thank you so much for sharing some important issues. I think could you take the noise? All right. Thank you so much. Thank you so much, Dr. Myers, for talking us through about the important issues you face as board of directors and trustees. Thank you so much for talking us through. So the next question for you is, you know, you specialize in healthcare, which is an amazing stuff, to do. So talk us through. You specialize in healthcare and education. So how do you see the intersection of these two projects, contributing to sustainable financial development? Talk us through, man.
Right. So yes, I have my passions actually in terms of the development space are in education and health. With my primary assignment in ABC Health, of course, you will know that a lot of my work revolves around the health development space to improve health outcomes at a regional level on the continent. I also have voluntary roles. So I am the head of the working group and the acting head of the secretariat of the private sector advisory group on SDGs in Nigeria on the sustainable development goals, and do quite a number of work uh, with education cluster members around universal basic education in Nigeria. And the idea really is to mobilize the organized private sector with their resources and innovative capabilities um, to to one network and also to deliver on particular initiatives. I believe that health and education are uh, inextricably linked. They are two sides of the same coin. And you would agree with me that a healthy child is more likely to attend school, participate actively, and achieve academic success. Conversely, education empowers us as individuals with the knowledge and the skills that we require to make informed life choices, creating a virtuous cycle of development, of impact, of growth, and also really protecting the society. Again, when somebody is educated, uh, they seem to also, be a bit more curbed when it comes to being irrational. It contributes to better health, literacy, and preventive care. And so for us, for me personally, um, I'm quite passionate on leveraging education to deliver better on health. Now, investing in both education and healthcare generally just reduces the economic burdens of diseases by investing, by preventing illnesses, by preventing the need for costly interventions. And this just allows for more resources to be allocated to other areas of development and growth. I think that what still entails is the two sectors on the continent and perhaps even in Nigeria still operating as separate development areas. Meanwhile, they are so intertwined and interlinked that a lot more can be achieved if education and health sector work more closely on some very important parameters and as the fundament of both areas of development. Over.
Thank you so much. It's amazing for you to state the fact that if there are enough funding in the educational sector and in the healthcare sector, there'll be a reduction of burden in the economic, in the company, in the nation's economy, which is an amazing stuff to do. But according to my research, as a medical student, I also, do a lot of researches. You know, there is not enough funding in the educational system in Nigeria. There are like few percentage income moving into the educational sector. So, man, I want you to tell us how is this going to affect the educational system in years to come because if there is not enough funding moving into the educational sector, inclusive the healthcare sector. So, what do you think about like what are the things that you know, your organization is working towards that next special, like to make there's enough funding in the educational and the healthcare sector. Take a statement.
Right. So we must understand that organizations by themselves are not directly responsible for the funding of any sector. Uh, so what happens is, so let me talk to both for education and for health. The first responsibility resides with the government, and the line with the government is from taxpayers' money. So the fact that our you and I mean, if you work, parents, people who work are taxed. There's a revenue that is being generated at national level, and that revenue is expected to be allocated in different percentages to different state governments for this kind of development. So, but over time, number one, we've heard about misappropriation, we've heard about insufficient allocation, and so on and so forth. So the story is that the allocation in the first place is never sufficient. Now, what you and I, as critical stakeholders, are required to do first and foremost is to create a lot of advocacy on what the issue and the challenges are, and also the amount of funding that is required, and the deficits, and also things around. So, if this amount is required for this, what has been used before? So, again, to kind of create that level of trust to be able to defend the fact that the allocated funding and resources by government is indeed insufficient and not just being, trailed away um, through the channels of corruption. And so it's to amplify those gaps, those multidimensional gaps inherent, especially in the health sector. And the flip side of it is that people actually lose their lives to a non-functional health sector in any nation, and as a continent. Africa is losing um, a lot of people, a lot of resources because of a non-functional or insufficient or inadequate, functionality of his health system. And so it lies on you and I, and not you as a medical student, you as an individual, and me as a critical stakeholder. And I like to call myself a non-health actor because I'm not a medical doctor. To create that level of advocacy and sensitize a multi-stakeholder approach to the knowledge of the ills of the health space. And I call it the ills because they're just all over the place. Majorly because of the death toll, because of the lives that are being lost due to the frailty of our health system as a continent, and of course as a nation. Having said that, is now to begin to get a bit more creative and a bit more innovative about where those solutions actually must lie, and to be able to defend them. So you see, we keep saying funding, funding, like a businessman is going to part with a lot of his money and say, go and use it to fix uh, public health or primary health care in your local government. That's unlikely going to happen. It needs to be a bit more um, reasonable in terms of, partnerships, for instance, public-private partnerships. The public sector has the infrastructure. They have uh, a lot of base knowledge about how these things function. Some private sector are looking for opportunities to invest and not fund, invest. And so it's the opportunity is to bring them together to be able to possibly create some solutions that can impact on population health and to save more lives that are really important. And understanding the dynamics of both parties and not assuming that somebody is going to wake up one day and come and pump in money into the health of a nation that government is primarily responsible for and government has assumedly been funded for. And so it's getting the narrative right and asking the right questions in the room and creating the right scenarios, the right partnerships, strategic ones, and the right, and opening the ecosystem for multi-sector participation as critical stakeholders and not narrowing it, because that's the one thing that Africa cannot afford. We cannot afford to replicate the narrowness um, of other health systems in advanced environments because it worked. Governments were responsible to their call in those countries. They funded what they had to, but they understood what the infrastructure had to be. And they funded, and were creative about even how to grow the funding mechanism. And that's what needs to happen here. We need to be more creative about the local issues around our around funding our health systems. Over.
Thank you so much. Thank you so much. Not driven, not driven. So the next question for you is, we've not really, talked about AI in the healthcare sector, but we're gonna move forward to that very soon. So that's the fourth question coming up with AI in healthcare. So artificial intelligence and digital health are evolving. Yeah, it's true that it's really involving in the healthcare and digital health space currently, globally as well. Now, artificial intelligence and digital health are rapidly evolving, sorry. So how do you think, in your own perspective, that this technology will change healthcare in the future? Talk us through, Dr. Myers.
Thank you for that question. I mean, my first line of response was just generally to say that uh, the world, and particularly Africa and nations, need to be a bit more proactive in leveraging AI. Number one, in accepting that AI has come, is real, and it has come to stay. In fact, I usually joke with my friends and say it's beginning to look like the next official language. So again, the way we have English language, and as a language that every educated person is required to understand, um, digitalization and AI is beginning to gain that level of ground. And so it's important that we put it in all our plans domestically and mainstream it in our strategies and agenda. Uh, Having said that, the integration of AI and digital health without being without even thinking too much about it will significantly transform healthcare. And while these advancements hold a great promise, it's important to consider potential challenges around data privacy, around ethical concerns, and the need for rigorous validation of AI systems when it comes to AI healthcare settings. Because again, an error can be really costly when we talk about just relying um, on artificial intelligence. It will require collaborations between technologies, between healthcare providers, policymakers, ethicists, and to ensure that these technologies are implemented responsibly and, of course, equitably. There are some key ways that the evolution of artificial intelligence will impact on the future of healthcare. Of course, I don't know, you've heard about personalized medicine, genomics is beginning to gain ground. It could analyze vast amounts of patient data, including genetic information, to tailor treatments and interventions. I was in Egypt a few months ago, and it was a big topic at the Africa um, Health Exhibition Conference. I mean, just even thinking about the possibility of it and the reliability of that kind of solution is by itself exciting. The fact that you can tailor medical care to specific human data and genetic composition, tailor treatment and interventions to that by itself uh, is a big step in medical evolution. Another one is early disease detection. Advanced AI algorithms will be able to detect subtle patterns in medical imaging or other health data. So, for instance, what could not be predicted before, just by watching the patterns, can now you can tell what is likely going to become of a person in terms of disease burden in another decade, in another 2 decades or so, just by studying the patterns through AI. Clinical decision support. AI systems also can assist healthcare providers by offering evidence-based recommendations for diagnosis, for treatment, for potentially reducing medical errors and improving care quality. Um, Drug discovery and development. I mean, without being said, to think about clinical trials and just even introducing AI into, which of course helps with precision. AI could accelerate the process of identifying new drugs, predicting their efficacy and safety, and potentially reducing the time and the costs of bringing new treatments to market. Uh, of course, we have things around predictive analytics, virtual health assistance, that's administrative support, administrative efficiency, and health education and behavioral change. Digital health platforms powered by AI can provide personalized health education and interventions to promote healthier lifestyles. Um, if the health community actually really mean business, and indeed the health of the citizen is as prioritized as it should be, then there should be more appetite, to do things more efficiently, more effectively, in order to save more lives. I think AI provides these opportunities. Every average medical person, medically training person, must consider AI as an enabler, must consider digital health as the way to go and the way to be a bit more effective in delivering the care that he or she is studying or she or she is currently performing. Over.
Wow. Thank you so much, Dr. Morris, for talking us through about, artificial intelligence and digital health, with rapidly evolving, strategies and what you think that this technology will, change the healthcare in the future. And I believe that the audiences have had a clue or have a clue already, of how healthcare, AI in healthcare and in digital health can indeedly, change healthcare in the future. Thank you so much for talking us through, ma'am. So the next question is, how does ABC Health integrate ESCP principles into its operations? Talk us through, ma'am.
Did you say ESG principles,
Yes.
environmental, social, and governance? Right. So, for us, developing our policies and ensuring that they are as robust and as relevant as possible is critical to the board and to the management of ABC Health. Again, I will believe that uh, one of the reasons that I got the role was because I was coming from um, a place of expertise in sustainability and in ASG, as environmental, social, and governance uh, principles. And so for us, with a lot of supervision from the board, uh, sustainability, ethics, and corporate governance are for us non-financial performance indicators and to help us to ensure accountability and the implementation of our systems and processes to manage impact. So when we talk about impact, we're talking about social, environmental, economic, and governance. Our mission as an organization is to mobilize resources and capacities of businesses and corporates to improve health and well-being, uh, working with, of course, government and the health community. and other critical stakeholders for a healthier continent. We focus on enhancing community well-being through our programs and partnerships. We support public health initiatives. We advocate um, for partnerships and for health equity. And we collaborate strongly with a multi-stakeholder lens to improve and to stimulate engagement in health and in and improvement in health outcomes. Actually, must drive any kind of interaction, any kind of relationship. I must grow it. So we maintain it through regular reporting. We maintain it through our internal control and uh, internal and external audit processes. We engage our stakeholders to keep them informed and incorporate feedbacks that they give. Again, I mentioned about our external reviews and audits by independent bodies were deliberate. So both our internal and external audit are performed by the big fours for objective assessment and for validation of our processes. And of course, to ensure continuous improvement as an organization. Over.
Thank you so much, ma'am, for talking us through about the operations, about your amazing organization, and how they use ESG principles to work with. That's amazing. Um, to hear that your organization has come thus far, helping, you know, the healthcare in Nigeria, especially, in general, and using all these amazing principles to work with. And I believe that your narratives about these questions, the audiences will really find it really enlightened, and find it really enticing as well, and interesting as well. And I believe that they've learned one or two things off from you and off from your amazing organization thus far. So the next question is, because I know you're an international speaker and trainer as well. So as an international speaker and trainer, do you have any advice for leaders in healthcare and education in general? Type of steerman.
Right. Thanks a lot. Well, my journey has been marked by a lot of deliberate commitment to advance public health initiatives and educational programs across diverse regions. And so for me, it's if I were going to advise other leaders, is your appetite needs to grow to go after the initiative that you claim um, that you are interested in. So for me, my background deeply rooted in both sectors. I have witnessed firsthand and transformative power of strategic leadership and collaborative efforts in driving the change that is required. So, in my capacity as an international speaker and trainer, um, I will say that as a leader, you must first and foremost embrace continuous learning. The fields of healthcare and education are constantly evolving. I talked about relevance when you asked about some of the issues, strategic of day-to-day running and of course being on the board and as a trustee. I think staying updated with latest technology, latest research, with latest market insights and methodologies in the field is very important. And also maybe and even social determinants impacting on the field. So you can't just say because you're health focused, you're never going to pay attention to renewable energy. How about how renewable energy impacts on health facilities? How about how it helps you to minimize cost? For me, it's embracing continuous learning first and foremost. Second is to foster collaboration, especially in healthcare. And I say healthcare because healthcare is the one sector where actual lives are lost, literally, um, if the necessary parties don't collaborate, if there are avenues and opportunities to collaborate and that those collaborations are not happening. So I put it upon myself actually to deliberately um, get people to network, bring potential partners together so that they can begin to explore possible strategic initiatives uh, to improve health and save lives. Education too is important in that sense, in the sense that scaling of impact. There's no point one person doing a $10 million project when the two of you can do the same project for just $15 million instead of 20. You can minimize cost and save and deliver and scale impact and save a lot of money if those partnerships happen. Another one for me is to prioritize equity and inclusion. We must together work to eliminate disparities in access to healthcare and education um, that are inclusive and, of course, diverse. We must invest in technology wisely and deliberately, um, and also attune to the relevance of technology in our times and how the global north and the global south are advancing with it. Otherwise, we might be left behind. Technology can greatly enhance both healthcare and education. We must, as leaders, implement them thoughtfully, ensure that they don't widen the existing gaps. We must focus on prevention and early intervention. Again, we must promote mental health and well being, develop strong communication skills, be clear, and you have to be deliberate about it. It might not come naturally to you, uh, but it's important as a leader in delivering your message and delivering your mission and what you hope to achieve. You must have empathy, um, which is will help you to make more to make more better decisions. You must encourage evidence-based practices and, of course, build resilient systems. Um, Recent global events have highlighted the need for flexible, adaptable systems. And I mean, you will agree with me that COVID-19 shook the whole world. If you weren't a resilient organization or person, COVID-19 would easily have really destabilized um, that artificial or natural person. So for me, those would be my basic advices to other leaders. Over.
And I believe that leaders in healthcare and education gonna watch this video. I believe that Dr. Mories, advice for you all is gonna be very tangible for you to, adhere to and follow that paved advice you shared on. So we've come to the last question for you, Dr. Mories. Now, with your experience in global health, all right, what are the current global health issues? Talk us through.
Right. I mean, generally, uh, current global health issues reflects a landscape that requires multifaceted approaches, and addressing them requires coordinated global efforts, substantial resources, and innovative approaches to healthcare delivery, and of course, public health interventions, improved data systems, capacity building, and so on and so forth. So it's important to note that the global health priorities can shift rapidly in response to the emerging threats, as we saw COVID-19 in different, uh, regions. So again, maybe for Africa, uh, one of the very high disease burden is malaria. When COVID-19 came, it did it did, take, the shine of malaria, if we can use that term. So again, my experience in global health tells me that some of the current global health issues are around infectious diseases. COVID-19 continues to evolve. We're hearing, new things every day. I still heard recently for help from health experts that, and I think even from, CDC, to expect something worse than COVID. How true and how evidence did that is, I'm not sure. Whether it's even being addressed, and it might never happen. We don't know. So with new variants emerging and challenging global vaccination efforts, uh, COVID-19 just really, uh, we should be concerned about COVID-19. HIV/AIDS also remains a significant problem, especially in developing countries. This, despite advances in the treatment, tuberculosis, particularly drug-resistant strains, poses a major threat. Malaria continues to be a leading cause of death in many tropical regions, across a large part of the African continent. And additionally, the world faces the risk of new emerging pathogens, as demonstrated by recent outbreaks of diseases like Ebola and Zika. Again, another one I think we should pay attention to will be uh, the ARM, our resistance to antibiotics, which is evolving. I think that the lack of control and use of antibiotics, especially in low and middle income countries, is posing also a threat to the resistance of those medicines um, that the world, solved years ago. And so for me, those are really current health issues that needs to be promptly addressed. Of course, at the point of non-communicable diseases, they are leading causes of death globally, accounting for about 70% of all death. Cardiovascular diseases, including heart attacks and strokes, are the most common. Cancer rates are rising partly due to increased life expectancy and lifestyle factors. Diabetes is growing rapidly and linked to obesity and sedentary lifestyles. Chronic respiratory diseases, often exacerbated by air pollution, affect millions worldwide. Again, air pollution due to industrialization by itself is also, getting a bit more complex and increasing. There's also mental health that we cannot even remove our thought process from. There's a growing recognition of mental health as a critical component of overall health. Um, I'd mentioned antimicrobial resistance before. I think that it needs to be given adequate attention. It is estimated that antimicrobial resistance could become a leading cause of death globally by 2050 if not addressed. Of course, there are also climate change impacts, health inequalities, uh, maternal and child health, largely predominant on the African continent, aging population, access to clean water and sanitation, and of course, strengthening of health systems. Many countries, especially low and middle income nations, they struggle with inadequate healthcare infrastructure, shortages of healthcare workers, and weak supply chains for medicines and medical equipment. These systems need to be strengthened for any kind of improvement in healthcare to happen. And so strengthening them is crucial for addressing all these other health challenges that we mentioned earlier and for preparing for future health emergencies. Over.
Thank you so much, Dr. Morris. It's an honor to have such a caliber like you on this amazing podcast, and I believe that the audience are really lightened. So if you wanting to know more, a little bit more about ABC Health, you know, the links, will be on the YouTube description below. And if you want to connect with Dr. Morris on LinkedIn, on Instagram, and all other social media platforms, you can connect with her with the links below. She's an amazing personality with a lot of experiences and offering value into the healthcare and public, services, home and abroad. and which is an amazing work that she's offering to the table. So we've come to the end of the session. Um, Before we wrap up the session, Dr. Myers, what are the last words for your audience before we wrap up the session?
Well, let's to really thank you, Ransom, for this opportunity, and maybe for the audience to ask everyone to keep up the spirit, to be open to collaboration, to learning new things, and to unlearn old things. To know that the digital world has come to stay, um, and AI should be learned, should be understudied, and should be leveraged to deliver more efficient results. Thank you.
Thank you so much, Matt. So we've come to the session. If you love this content, do well to like, share, and comment as well. Also share to your network. Thank you.